moving on to actually what can be done or what you are doing. And so I'd like to start, Dr. Osama, with you. You mentioned the DHA's innovation strategy.
Yes.
You said there were sort of 13
So this is the transformation strategy, but innovation is a core.
So what are we? It's obviously a massive document, so we
Yes.
can't do the whole thing. But broadly, what are the sort of the things? What are the innovation areas that you are looking at? So artificial intelligence,
Yes,
big data.
Yes, so we're talking about the innovation strategy. So we focus on certain areas. One of them is artificial intelligence, of course. So we need to develop algorithms that can support even consumers to do the first gates of healthcare. So instead of going to hospital directly, we get some sort of an app that can support you.
So this is about primary care online.
Yes,
you can
exactly.
pre-diagnose or.
That's right.
And where are we today on that service?
So actually, because now what we are trying to do is we are establishing what we call the Innovation Center of DHA, where we are going to incubate SMEs who have these kind of innovative ideas.
Oh,
so
really?
we bring them on in our incubation center. They come up with their ideas, so they could be university students or small, medium-sized companies. Then we work with them in kind of a joint venture to develop this. And this innovation center is going to be open very, very soon.
So if I have actually been at some conferences recently where I have met people who are producing apps for the health sector. If they want to get involved with DHA, what do they do?
So they have to contact DHA innovation team, and we are ready to.
Okay, and what you provide is an incubator, a facility, premises where they can.
Yes, exactly.
Services.
Very soon this will happen.
Okay, and what else is in the innovation strategy?
So part of the innovation center, what we call new care model. So as I told you that now we are trying to have new ideas on how to deal with patients. So rather than bring them to hospital, maybe we can push some of the efforts to home care, for example. So home care is one of the key pillars in our innovation strategy. So maybe we can send nurses or social workers or health workers to home rather than bringing a patient to the hospital.
Your job title is head of e-health.
Yes.
And what I think I'm hearing is that partly it's about the communication, the sort of openness of the network.
Yeah, exactly. What we call the health information exchange. This is a project called NABID. So NABID has already been launched as a concept in February 2016. And now we have a very massive tender around it. And we're expecting it to start by early next year.
Prashant, if I can ask you, on the private, so NMC, you have 9 facilities in Dubai, did you tell me?
Yeah. Overall, we have 48 facilities, of which the entire UAE has got around 31 facilities.
31, sorry, my mistake. Where does innovation fit into a private sector operator's mandate? You know, what do you look at?
See, as we discussed, as Mr. Zama said correctly, we need to really connect to the people. And that connect happens from the primary healthcare. The people should start using family physician, have to go into the center which is next to your community. That definitely will make sure that the patient get the right, information that is needed. And there will be somebody who can handhold the patient towards that. But that journey is longer for a private sector. We have taken certain, maybe looks very simple initiatives.
Why is the journey longer?
The primary health sector is not from a financial business model. Sometimes it may not be the right journey. You can have in certain locations. For example, we also hold some 8 or 9 centers like that, but it cannot be a widespread that you can create it.
So because of the level of investment required for a
the
private
return,
company,
to
it's
get the
better
return
to
of
invest in a
investment.
hospital or something.
No, not only that, the community, the number of people, the footfall that you needed to make sure that you develop and generate that.
So sorry to interrupt, for what you're needing then is an integration with the primary facilities from the government sector.
Exactly. So, that's what I was trying to say, that we try to work along with the government sector, whereby how we can work together on it. There are solutions where there is no need of infrastructure to be connected to both of us. One of the very good innovation that we have done, which again going back to the LPI, where we talk about the mortality rates, UAE's biggest killer even now is one of that is the road accidents. How can we work as a private sector seamlessly with the government initiatives to make sure that this mortality rates has to come down. Today we are talking about UAE from the wealth index, from the social well-being, from the infrastructure, much above many of the countries in the world. Why should somebody die on the road because they didn't get the right treatment at the right time, when the healthcare industry has really matured in a country like UAE?
So how does innovation help that? I mean, so that's about getting somebody to the accident spot quickly,
right
and then
time,
getting them from there to the,
exactly.
the doctor.
So that,
quickly.
yeah. So how will you make sure that the ambulance reach the patient on time?
Yeah.
How will the ambulance driver identify which is the right hospital on time? How will the hospital be ready with those things to get the patient the right treatment? How, in case if the patient goes into a cardiac issue, how can you give him the first aid at the right moment? So it's a composite solution that is needed. It is healthcare is not like a quick fix like how it happens in a financial sector or on a commerce sector. It needs a complete solution that finally which has to be accepted by the medical fraternity.
Okay, so that, what does that, if I break that down, what does a complete solution mean? Does that mean, as Dr. Osama talked about, is that a communication network?
Communication network.
Or is it better infrastructure, or what does it?
It's a combination of all. For example, like, you know, it may be an app, simple app that, for example, you know, we are very happy that to note that Dubai government is working towards a heart safe city concept. So, you know, wherein the entire, or like the one which we work with Dubai Health Authority on an ambulance, connect with the ambulance system of the Dubai government, whereby there is an app that should work between the hospital, between every citizen who is, or the resident of the UAE should have been able to give that particular information through the app to the center, which is the back office, which automatically give the signal to the ambulance provider to pick which is the ambulance available next to that patient.
So is this a kind of
telecommunication,
an online 911,
yeah,
I feel like, where,
yeah, exactly.
you know, instead of making a phone call and saying there's been a car crash
exactly.
on Sheikh Zayed Road, you go onto your app and
yeah, to
say,
an extent where the new concept of camera coming in the car, where automatically it generate the signal that something has happened to the car in this particular point. That's the new concept that is coming in.
So who needs to make this happen? So you have obviously the regulator and the government, you have the healthcare provider. Who else needs to be involved? The car manufacturer?
No, I think the in UAE now we are working on it as a compulsory thing on the camera to be connected to the cars. You need the telecommunication industry to come in. You know, so we are currently working with DHA and do on the blockchain. Okay. So you know, so you need a maybe the municipality has to work along with that. I saw a white paper on the Dubai Heart Safe City. More than 21 institutions are working along with that. And you know, from there to a simple initiative like the government's initiative of Ministry of Happiness. I'm just, you know, take one clue from Osama, talking about the mental health happiness, the mental health of the people. If you really look at it, the Legatum Prosperity Index talking about the joyous they rank on joyous, they also rank on sadness. So you need to really go into that and get it, and I'm sure the Ministry of Happiness creation whereby will definitely help. So in that, you are bringing an ecosystem whereby non-healthcare, private and government institution also coming and pitching in and giving what they can to help the entire mental balance of the people. Okay,
so joined up, bringing together people who previously haven't been necessarily involved in health or don't consider themselves healthcare.
Exactly.
So innovation is partly about building new communities or new ecosystems.
It's a good ecosystem.
So this also includes connection with non-healthcare, as he said. So for example, for some patients, sometimes the treatment is not medication, maybe just to make sure that you have the right food in his fridge. So this will we need to connect the social system with the healthcare system.
So does this bring in the Internet of Things, where the fridge can tell you?
I'm not talking about this, but I'm talking about the social workers who work with the social medicine. Okay. So we know that this patient needs some social care to support his health. This is another way of doing things.
Okay, now Daniel, if I can come to you before we go to, we have so many questions, and keep them coming. Thank you for your questions. From an insurance company point of view, then, what does innovation in the healthcare industry or sector mean for an insurer?
So one of the primary initiatives we've had around innovation recently is trying to measure quality of providers, hospitals and doctors, and trying to use that as a better way to understand performance, and then in the long run pay hospitals based on their performance. So in the past, prices have been set more on negotiation terms, depending on market size of the provider or the payer. But we want to move that more towards an evidence-based system where you pay a provider based on the quality outcomes that they have.
So does this mean, so an insurance company insurance is all about risk and assessing the exposure, your financial exposure, and in the past it would be what sort of percentages, and now you're trying to get much more detail about the quality of the service.
Right. We're trying to understand, one, we care a lot about our members and whether they're getting quality care. So that's really the first driver, understanding what are the outcomes for them. Are there better ways to achieve the same thing? Are there more efficient ways to achieve the same outcomes? And then using that as part of how we develop the network. So there may be some very good, excellent service providers who are also very expensive. You get nearly the same quality and you drop down a significant amount in cost. So you can stratify your network. Somebody wants to pay a higher premium, they could access the highest quality. If they're willing to pay to accept something that's nearly the same, but for half the price, they can also make that decision. So it really, it informs a lot of decisions.
So in terms of delivering change or delivering innovation, what does that mean? I understand the logic that you want more precise data, but what does it mean in terms of changing culture or systems?
Well, as soon as you start to measure something, you see an immediate change in performance, whether you're measuring overutilization or whether you're measuring outcomes, good or bad. So we see already, we've been measuring now for the last 2 years, and we can see an increase in the trend in terms of fewer readmissions across the board, fewer complications. So I think as soon as you shine a spotlight on behavior and people understand that there's a KPI behind it, then they begin to, the payment mechanism motivates providers also to perform better, and so that's really what's behind it.
And I guess from my perspective as an outsider, there seem to be sort of 3 parts to that which are challenging. So the first would be the data collection, actually getting accurate data, which is always difficult. Second would be data analysis. That's a skill in itself, isn't it? To actually, all this data, how do we turn it into value? And the third would be regulation, actually the availability and security and transparency of data. Are those the kind of 3 areas?
Exactly. So of course, without data, you can't measure anything. So I think Abu Dhabi was very innovative back 10 years ago when they started off with e-claims, right? So the government mandated e-claims from the beginning. So immediately you have electronic data to work with. Once you build up a critical mass of that and you've built an infrastructure that can analyze it, then you can really start to do some interesting things. Daman went through a long journey, and maybe about 5 years ago reached a point where they created an intelligence department which was specifically focused on data, began hiring data scientists and engineers to build tools and to build apps and to understand performance.
So you as well as doing the data analytics, you're building tools to
That's right. So we have a department called digitalization,
analyze,
which is focusing on improving the apps that we have and also looking at other ways that we can connect better with our members, right? Ways to directly, a lot of our business is to corporate, so it's about trying to connect directly with our membership, understanding what their needs are and be more responsive there. So a lot of the innovation we do on the digital space is around interaction with customers.
Okay.